Thank you for watching this presentation. My name is Jennifer Newbould. I'm going to be talking today about the educational mental health practitioners embedding a new health workforce within education. This project is a joint project between BRACE, the Rapid Evaluation Centre, and PIRU, the Policy Innovation and Evaluation Research Unit. So the EMHP role I'm going to talk to you about today is part of the Trailblazer programme. And just to give some context around the Trailblazer programme, the proportion of children and young people experiencing mental health challenges are considerable and increasing, as we know. And in 2017, a green paper, Transforming Children and Young People's Mental Health Provision paper, was published. And in response to this, in 2018, the Trailblazer was set up, an initiative launched by the Department of Health and the Department of Education, and it funded the creation of mental health support teams. There was initially 25 Trailblazer areas, and they were set up in 2018 and 2019, and the discussion today focuses on that intake. So central to the Trailblazers was this new role of the educational mental health practitioner, which is a paraprofessional role. And in England, there's a clear strategy of growing the mental health workforce through new paraprofessional roles, which enables the mental health workforce to grow more quickly and more cheaply than via traditional routes such as a clinical psychology route. EMHPs are located within primary and secondary schools and within colleges, and they support children and young people with mild to moderate mental health needs. EMHPs undergo a one-year training programme, and they work within the mental health support teams, and they really have three aims. The first is direct interventions, which is working one-to-one with children and young people. The second is the whole school approach, which is supporting schools and colleges to deliver a whole school approach to mental health and to wellbeing. And the third is liaising with and signposting wider services within the community, giving advice to education setting staff and working with other services in the area. In this talk today, we'll examine the experiences of the first cohort of EMHPs, in particular reflecting on how their training has equipped them for their role and exploring some of the challenges that they've encountered. We will also explore from the perspective of schools and colleges how successfully EMHPs have established themselves as a source of support for children and young people with mental health challenges. So the findings that I will present today are drawn from the early evaluation of the Children and Young People's Mental Health Trailblazer programme, and the data was collected between July 2021 and December 2021. The interviews were conducted with EMHPs and those who work alongside them, so supervisor and colleagues, in 5 case study sites from across the 25 areas that we discussed. Alongside that, there were 2 surveys of staff from 25 Trailblazer sites, and 2 surveys of schools and college staff. Other data were collected as part of this project, but I won't be presenting those today. Across all 5 case study sites, EMHPs were spending the majority of their time providing one-to-one direct support for children and young people identified as being in need of mental health and wellbeing support. It was widely acknowledged that relationship building with schools and colleges was critical to success in embedding EMHPs within schools, enabling them to work with school and college staff. Senior staff were often instrumental in building these relationships and sustaining relationships with schools, largely given the relative inexperience of EMHPs in their role. There were challenges to working in the education setting, for example, getting to know schools when they were not in schools for long periods of time. The amount of time that EMHPs spent in schools varied from between 3 and 8 settings per week. And as you can see in this quote here, settling into the schools could be quite difficult. For example, sometimes EMHPs would be in staff rooms and they wouldn't know any of the staff and the staff wouldn't know them. Building relationships with schools had sometimes been challenging, not least during COVID-19 where EMHPs had worked remotely. Across all case study sites, there was challenges to retention in the EMHP role. Reasons for this included differences between expectations and reality of the role. The role as taught during the training was sometimes very different from how it felt when EMHPs were in practice. Demands of the role were also cited as challenging, for example, heavy workloads, associated burnout and stress, and the exposure to children and young people with great mental health need, greater than could be met by the EMHPs. Lack of progression in the role was also identified as a challenge. There were limited senior roles within the EMHP teams, and sometimes these roles were unpopular as they meant no direct contact with children and young people. In some sites, they tried to create new roles to ensure career progression for EMHPs. The pay, relative to equivalent NHS roles, and lack of long-term job security were also a challenge. In some areas, EMHPs were on fixed-term contracts. In all case study sites, challenges with EMHP retention led to challenges in the service, particularly in maintaining relationships with schools and colleges. When an EMHP left, it was hard to find a replacement as the training happened twice a year, and then this lack of staffing put other staff under pressure, sometimes led to others leaving. There was a widespread view that the programme must prioritise the issue of career development and progression for EMHPs in order to reduce attrition and promote workforce sustainability. As shown in this quote here, sometimes the sustainability of the entire EMHP programme was seen to be dependent upon the career prospects of staff and retention issues. Supervision of EMHPs from more experienced staff was noted as being central importance. A supervisor would support staff emotional well-being and also their workload, but also to mitigate risks such as safeguarding. Intensive supervision was provided to EMHPs, particularly during their training period, but also ongoing once they were fully qualified. The time-consuming nature of supervision meant it was often hard for senior staff to carve out time for other things, such as service development. There was acknowledgement that even with intensive supervision, sometimes this was not enough, as shown in this quote. I'd like to finish by exploring the role and the impact of it on schools and colleges. We conducted a survey of schools and colleges, and respondents were generally supportive of the programme and being able to increase the provision that they could provide for students with mental health problems and challenges. The data here is from a second education setting survey and shows the support schools and colleges were receiving from their MHST and their EMHP to introduce or develop a whole school approach to mental health and wellbeing. The highest level of support, as you'll see here, is for mental health promotion, followed by engaging pupils to identify issues to address through mental health work and wellbeing work in the setting. Staff in schools and colleges welcomed the EMHP role and the extra support they were able to provide for children and young people in need, as shown in this quote here. However, there remain challenges with long waits for children and young people to see services for more complex mental health needs such as CAMS, and also some frustration that some of the young people which the schools identified as most in need were outside of the boundaries of the EMHP role or the MHSTs. These included those actively self-harming, children with suicidal thoughts, and those with eating disorders. And also, there was a lack of provision for young people with neurodiversity and special needs and disabilities. In some areas, these children were considered out of scope of the programme. This sometimes presented a challenge to schools and colleges, as these children and young people could be those that they most deemed in need of support. There were also limitations to the number of children and young people an EMHP could support if they were only in the school a small amount of time, and demand often far outstripped supply. So in terms of the implications for this role, the development of the paraprofessional EMHP role has enabled a relatively rapid expansion of the children's mental health workforce, but there are challenges to this role. Although it's welcomed by schools and colleges, As just discussed, there's some young people that this role is not able to support. Additional training of EMHPs in working with those with neurodiverse needs, eating disorders, or self-harm would enhance the support that EMHPs can provide to children, young people and schools. Further consideration of career development and progression are needed to ensure the stability of the service. Thank you for listening to our talk today. Please do get in contact if you have any questions or queries or would like any more information. Thank you.